Hello student, how are you? I hope all of you are doing good. Today I am going to discuss different schedules related to Drugs and Cosmetics Act. Okay, so last class we discussed basic things related to Drugs and Cosmetics Act. I told you this act came into existence in 1940 and drugs and cosmetics rules came into existence in the year 1945. Okay, I told you about the objectives of Drugs and Cosmetics Act. The main objective of Drugs and Cosmetics Act is to regulate import, distribution, sale of drugs and cosmetics. Okay, so I told you that in Drug and Cosmetic Acts also there are some schedules. Okay, so in the Drugs and Cosmetics Acts there are two schedules, Schedule 1 and Schedule 2. In Schedule 1, the list of the different books related to Ayurveda, Unani, Siddha system is given, and in Schedule 2, the standards are given. Okay, so today we are mainly going to discuss about the schedules related to drugs and cosmetics rules which came into existence in the year 1945. Okay, so one thing I want to tell you that drugs and cosmetics rules contains 23 schedule. Okay, so these things are very important for not only for this exam, these are important for your future all the interviews and competitive exam also. Okay, hamesha you will get questions from this schedule. Okay, in interview also, in job interview also you will get. For in other case, in competitive exam, for example GPAT also, you will get questions from these schedules. Okay, so list of the schedules I will provide in the material. Here I am discuss only the main schedule. Okay, so first schedule, Schedule A is from different performers available for application for the license issue or renewal of licenses for standing memorandum under this act. That means ए शेड्यूल में क्या है, बहुत सारा फॉर्म होता है जिसको चाहिए तुमको लाइसेंस इशू करने के लिए, नहीं तो लाइसेंस रिन्यू करने के लिए. ओके, सो कैसे तुम याद रखोगे, ए फॉर एप्लीकेशन. ओके, what is given in the first schedule? In the first schedule, different performa means application, performa for application for the license issues or removal. Okay, is it clear? Second is Schedule B. In Schedule B, it is given that the fees that are required to do test or analysis in Central Drug Laboratory or State Drug Laboratory. Then another important schedule is C. Okay, in Schedule C, list of biological and other special products is given. So what do you mean by biological products? For example, sera, antitoxin, vaccines, these are biological products. Okay, it is very important. Generally question comes from Schedule C. Okay, then Schedule C1. In Schedule C1, the special products other than given in Schedule C is given. Okay, so there is a simple difference between Schedule C and Schedule C1. In Schedule C, all the parenterals biological products are given, and in Schedule C1 other substances are given. For example, in Schedule C1 in Schedule C, vaccines are given. Parenteral means, you know that parenteral means the substances which are given in the injectable form. Okay, so in Schedule C you will get the different biological products which are given parenterally, and in Schedule C1 you will give the other special products which are given not parenterally. For example, digitalis, okay, adrenaline, this type of drugs are given in Schedule C1. Very important, please keep it in mind, Schedule C and C1. Okay, next important schedule is Schedule E1. Okay, Schedule E1 is the list of poisonous substances under the Ayurvedic Siddha and Unani system. Okay, so कैसे याद रखोगे तुम लोग? Poisonous means it is bad thing, so evil, that means bad means we may say it is evil things. Okay, E for evils, that means schedule M में क्या है? List of poisonous substances. Okay, so this is the very important schedule. Okay, another is schedule F. F is in schedule F, requirement for the functioning and operation of blood bank is given. blood bank को अच्छे से रखने के लिए क्या करना पड़ेगा? इसके लिए शेड्यूल F में दिया है. ओके, ठीक है. नेक्स्ट इंपॉर्टेंट इज शेड्यूल FF. Okay, double F is very important. Okay, so in the schedule FF, standards of ophthalmic preparations are given. So what do you mean by ophthalmic? Ophthalmic means all the substances, medicinal substances related to eye. Okay, so in FF, standard of ophthalmic preparations are given. Okay, so कैसे याद रखोगी? So we can relate F for focus. Okay, focus. कैसे हम लोग फोकस करते हैं? थ्रू आई से. ओके, सो इसीलिए कैसे बोल सकते हो? हियर स्टैंडर्ड ऑफ ऑप्थेल्मिक प्रिपरेशंस आर गिवन. ओके, नेक्स्ट इज द जी. ओके, इट इज वेरी इंपॉर्टेंट. ओके, इन द शेड्यूल जी, लिस्ट ऑफ सब्सटेंसेस दैट आर रिक्वायर्ड टू यूज ओनली अदर मेडिकल प्रैक्टिशनर एंड व्हिच आर लेवल अकॉर्डिंगली. जी में क्या होता है? The list of substance that are required to be used only under the advice of medical practitioner. ऐसा सब्सटेंस को के बारे में लिखा है जो सब्सटेंस सिर्फ जब मेडिकल प्रैक्टिशनर तुमको यूज करने के लिए बोलेंगे तभी तुम यूज कर सकते हो. ठीक है, ये वेरी इंपॉर्टेंट है ये शेड्यूल. ओके, नेक्स्ट इज शेड्यूल H. शेड्यूल H में क्या है? लिस्ट ऑफ प्रेस्क्रिप्शन ड्रग्स. The drugs which is given in the prescription are under schedule H. Another important schedule which is introduced recently, in 2000 might be 2011 and 14. This schedule was introduced in drugs and cosmetics rules. It is for curbing the misuse of antibiotics and other drugs. Schedule H में क्या लिखा है? Misuse of antibiotics and other drugs के बारे में लिखा है. Generally we do misuse in case of antibiotics. Generally क्या होता है? कुछ होने से हम लोग खुद एंटीबायोटिक ले लेते हैं और थोड़ा अच्छा होने से हम लोग 10 एंटीबायोटिक खाना है, 5 दिन का कोर्स है, हम लोग 2 लेके नहीं करते हैं, है या नहीं? This is the case of antibiotics, is it or not? Yes. Okay. Next is another important schedule. It is schedule J. J में क्या होता है? यहाँ पे disease or ailments which a drug may not purport to prevent or cure. Okay, ऐसा डिजीज के बारे में लिखा हुआ है जो दवाई में कभी उसको completely क्योर नहीं कर सकता है. फॉर एग्जाम्पल डायबिटीज, कैंसर. ओके, ये सारे डिजीज हम लोग completely क्योर हो सकता है क्या? नहीं, उसको हम लोग सिर्फ बैलेंस फॉर्म में रख सकते हैं. ठीक है या नहीं? फॉर एग्जाम्पल प्रेशर, हाइपरटेंशन, अगर तुम दवाई नहीं लोगी तो हाइपरटेंशन ठीक नहीं होगा. वो हम लोग थोड़ा टाइम के लिए हम लोग क्या कर सकते हैं? इसको कंट्रोल में रख सकते हैं. सो दीज आर द डिजीज इज इंक्लूडेड इन शेड्यूल J. अनदर इंपॉर्टेंट थिंग इज M. शेड्यूल M. शेड्यूल M defines the good manufacturing practice and requirement of factory premises and equipment. शेड्यूल M में क्या होता है? गुड मैन्युफैक्चरिंग प्रैक्टिस का जो रिक्वायरमेंट है उसके बारे में लिखा है. तो कैसे याद रखोगी? M for manufacturing, that means M for GMP, good manufacturing practice. Another important है schedule T. Schedule T क्या होता है? Same thing, but in this case good manufacturing practice for Ayurveda, Siddha and Unani system. In case of M, it is for the allopathic system. In case of T, it is for Ayurvedic, Siddha and Unani system. Next is important is V. Very important schedule V. V is standard for patent or proprietary medicine. Standard for patent or proprietary medicine. Schedule V is given. And another important schedule is schedule W. Here, list of drugs which is to be marketed under generic names only. तो अभी यहाँ पे ऐसे याद में रखो, V में होता है प्रोप्राइटरी ड्रग के बारे में और W में होता है जेनेरिक ड्रग के बारे में. नेक्स्ट वेरी वेरी इंपॉर्टेंट इट इज X, शेड्यूल X. ओके, in X list of drugs which import, manufacture, sell, labeling and packing are governed by special provisions. Okay, list of drugs whose import, manufacture, sale, labeling and packing are governed by special provisions. उसको भी कैसे याद रखोगे? X means हमेशा जहाँ पे X होता है क्या होता है? Danger. Okay, so ऐसे याद रखो, list of drugs which manufacture, sell, labeling and packing are governed by special provisions. Another important and last schedule you have to remember that one is Y. Y is requirement and guidelines for permission to import and manufacture of new drugs for sale or undertake clinical trials. Only one word you have to keep in mind, that schedule Y is for clinical trials. Okay, so there are 23 schedules, but I am discussing the most important one in this class. In the note you will get all the schedules, but what I am telling this class you have to keep it in mind for not only for this exam, for future exam also. Okay, so please watch the video properly, okay, till the end. It is very very important topic, and these drugs and cosmetics is the main important legislature in the field of pharmacy. Okay, so please I request you, all of you, to watch the video till the end. Okay, so another thing, any problem you can call me, you can WhatsApp me. Okay, but please tell me your doubt. Okay, last class I conducted a doubt clearing sessions, but only few students attended this class. But in next doubt clearing session I hope all of you will come and join this class. Okay, thank you.